Ladies and gentlemen, thank you for your interest in this course on musculoskeletal pain. I thank Aptica Training for organizing this course, and I'm very glad that you are shown interest in this matter. I want to introduce myself a little bit. I'm Hans-Georg Scheible. I'm working as a professor at the University Hospital in Jena. I'm working at the Institute of Physiology and Neurophysiology. And our main interest has been for many, many years the neurobiological mechanisms of musculoskeletal pain, in particular joint pain. And it's my pleasure to introduce this method to you and show you different aspects of this. I think it has some relevance also for practical things. So just listen to my talks and you will see that much of it is related to your practical work. Now let's start with the introduction. What is the significance of musculoskeletal pain at all? Why is it so important? First of all, it's the most frequent chronic pain, at least. Yeah? You see here a big survey of chronic pain in Europe, some years old now, but still it's valid. So this group called up more than 46,000 persons in 15 European countries and asked them, do you experience pain? And 90% of the persons said, yes, they have chronic pain. They suffer from chronic pain. And you see on the left side where the pain was located. But more important, what was the main reason for the pain? You see here, it's more or less all musculoskeletal pain. Leading is arthritis, osteoarthritis, but also rheumatoid arthritis, fractures, cartilage damage. So it's very frequent. And so that's one of the reasons why it's so important. Most of the patients you will see are complaining about musculoskeletal pain. A second point is the musculoskeletal diseases. They are diseases of different tissues and different pathological processes. And this makes it very complicated. One can ask, for example, what's the contribution of the different processes and the different tissues to the pain? Now, we have, for example, the osteoarthritis. Osteoarthritis, very frequent disease, as I've seen. This is a disease of the joint, but if you look very carefully, it's a disease of the cartilage, the bone, synovia. So it's a complex disease involving many different tissues. Same with primary chronic rheumatoid arthritis. There's a lot of inflammation in these joints, but in addition you have bone destruction. So the question is again, what contributes to the pain? And next is that we have even to consider that it could be a neuropathic pain. You see here a lot of causes for neuropathic pain, and on the right side you see, for example, neuropathic pain can appear in autoimmune diseases such as rheumatoid arthritis. I will give you more insights, of course, in that during my talk. This is just the introduction. The vertebral column is a site where all these pains can come together. It makes it particularly important and complicated. The next point is musculoskeletal diseases that cause neuroplasticity at all levels of the nociceptive system and may cause severe symptoms, not only pain, but also other symptoms beyond pain. Now, you see here, what I will show you later, that all the different levels of the nociceptive system are involved, the peripheral level, the spinal level, the supraspinal level, and I will show you in the course the changes which have been found in these different levels. Now, and I just said, it's not only the pain which is important, it's often associated with fatigue and psychological disturbances. Yeah, that's another quite important reason why to deal with musculoskeletal diseases. Next point is, we have so far been talking about pain only, but the nervous system does not only produce pain and suffering, it has also the potential eventually to regulate the inflammation. This is quite important and quite interesting, though this will be another topic of this program. The immune system can activate the nervous system. On the other hand, the nervous system can activate or inhibit the immune system. This is quite important. And finally, many patients with musculoskeletal diseases, they have comorbidities. These comorbidities, they have an impact on the disease process and the disease process in general, and in particular also on pain. And you will see some of this in one of the talks. OA has often comorbidities such as diabetes mellitus, cardiovascular diseases, and metabolic syndrome. So this is the program of the course. And I will start now with the first lecture, giving a lecture on the anatomy of and function of the nociceptors. Thank you for your attention.